it's Dr. Harper. In this video, we're going to talk about birth control and how it might be affecting your desire. Don't get me wrong, I love birth control. I think the fact that women get to choose when and when not to have a baby is so exciting, and it makes such a difference in our lives and in the lives of women everywhere. So I definitely don't want to be seen as bashing birth control because I think it's awesome. But I do think that if you're having trouble with low desire, that it's important to know how the birth control that you've chosen might be affecting it. So when we talk about the most common form of birth control, that's a birth control pill. And most frequently, these contain estrogen and progesterone. So those are called combination oral contraceptive pills. And whenever we look at the studies behind these, we really see that the data is mixed. So in some studies, it will improve desire. In other studies, the desire will be less. But for most women, it doesn't actually have an effect on desire. Other types of birth control that are common are a vaginal ring or a patch that goes on the skin. And the data for those are also mixed. In some studies, it shows improvement. In some studies, it shows that it's worse. So what I always tell my patients is that if you're having great desire and then all of a sudden I start you on a new birth control and your desire tanks, well, that to me tells me that it's probably your birth control. But if you've been on the same birth control for ages and then your desire goes down, it's probably less likely to have to do with your birth control and more likely to be something else. So something to keep in mind. Other types of birth control that are super popular right now are IUDs, and these are intrauterine devices that go in the uterus to prevent against pregnancy for several years. There's one that's popular that's made of copper. It doesn't seem to have much of an effect on sexual function. And then there's another group that have progesterone in them, and there is some data to suggest that they might improve sexual function and desire. But I will have an occasional patient who thinks, you know what, this IUD actually made my desire go out the window. And it's important that we listen to our patients on an individual basis because every woman experiences these symptoms differently. It's also really good to know that you might be experiencing some symptoms and then you start birth control to help those symptoms, and then that improves your desire. So if a woman is having trouble with pelvic pain from endometriosis or fibroids, or if you're avoiding sex because you're always bleeding or having heavy bleeding, or you have pain from an ovarian cyst, then those are reasons why your doctor might start you on birth control. And because you're then controlling those symptoms, your desire and your sexual function might improve. So that's another way to think about birth control as well. So whenever you're thinking, is my birth control doing this? Is it not? It's important to keep in mind that one size does not fit all when it comes to birth control. Every woman reacts differently, and it might affect her libido differently too. So if you think that your birth control might be the problem, make an appointment with your doctor so that you can discuss which birth control options might be better for you and your certain situation. That way we can help you stay healthy both in and out of the bedroom.